Hello and welcome to Mystery Us. I'm Tony Pratt, your host for Mystery Us, and today on the program we have two very fascinating guests, Dr. Ben Johnson and June Drennon. And the topic of the program is thermography. Welcome to Mystery Us.
Thank you.
Thank you. It's so good to be here.
Now, Dr. Ben Johnson, you appeared in the movie The Secret, which
That was
is
a lot of fun.
like the most popular movie ever.
#1 cult classic. I mean, it's the #1 selling DVD in the world, and the sales are still going up every day.
And
Pretty amazing.
how did you get involved in that?
Well, it's called The Secret. The law of attraction. I didn't know anything about it when I set for the film, but I was in my clinic in Atlanta. I had a international cancer clinic, alternative medical clinic for cancer. And I was thinking, you know, what I would really like to do is to help a lot of people stay well instead of helping a few people recover from sickness, because it is so much easier to stay well than it is to get well.
Right.
And so at a moment in time, I had that intent. And here I am. It's happened. So I use the law of attraction, which is what The Secret is about.
Cool. Now, June Drennon, you are Dr. Johnson's partner.
In thermography.
In thermography.
Yes, we
Okay.
are.
Now, your credentials is you're an MD, DO, and NMD. What is a DO and an NMD?
Well, a lot of people don't realize that there are two medical degrees in the United States. MD and DOs, Doctor of Osteopathy, are fully licensed physicians. They
Right.
they have all the training that MDs do and more, so they actually have a superior degree, if you would. They're more highly trained. They can do anything that an MD can do and more. So pediatrics, obstetrics, neurosurgery, whatever it is. You go through a very similar pattern of training, and you're licensed in all 50 states, the armed forces branches. I was a flight surgeon in the Army Reserve as a DO for a number of years before I also got my MD. And then NMD is a naturopathic medical doctor. I became so enamored with natural healing as opposed to drugs.
Yes.
That I wanted to do the natural whenever possible. So I realized that there was so much information there. Naturopathy, homeopathy, iridology, so many things that I decided that I needed to go back and get a formal education in this. So I went back to school and got my naturopathic medical degree.
Now, June, you are a certified clinical thermographer also.
That is correct.
Okay, now what kind of training does that entail?
Well, MediTherm is an international company. They were originally from Australia. Now they've moved their home base to Fort Myers, Florida. And they have the American College of Clinical Thermography. I went down there this last fall and got my certification.
Right.
I am certified to take the images. I do not read and interpret the reports.
Right.
Those are all sent to medical doctors that are licensed in the United States and certified in thermography, and they read the reports and then send the images back to, or excuse me, the reports back to me, and then I send those to the patients.
And the name of your business is Thermography Limited. And that's also the name of your website, thermographylimited.com.
Correct.
We'll have that up on the screen a few
Okay,
times.
thanks.
Now, tell me about thermography. What is thermography?
Well, it's thermal imaging. Actually, the technology came originally from the military, night vision goggles, but it was starting to be used in medical field in the 1980s. It did receive FDA certification back then. Then there were some problems with it. The FDA certification was withdrawn, and that is why you do hear a little bit of controversy about it now. But in 1992, they again received the FDA certification, and so since that time it has been used in medical fields, in the conventional medical community, not as much as the alternative community, but both, because they are read and interpreted by medical doctors, and so they do become a part of a person's medical file.
Now, it's used for breast thermography, and the title of your book is The Secret of Health, Breast Wisdom.
Absolutely. You know, that's an area that has, if you watch The Secret, it's the law of attraction. what has the medical field been putting out there for women? It's fear.
Right.
Fear is not a healthy emotion. Women should not be fearful about their breast or what's going to happen. So I wanted to change the paradigm from breast sickness and disease and fear to health. What women need to do to keep their breast healthy, on their chest, out of the doctor's office, because it's really very simple to do and easy to do. It should not be a matter of fear. That's a beautiful thing. We all enjoy that aspect of femininity and appreciate it and respect it. And so let's be happy and let's be about healthy breast,
Right.
and not about sickness and disease. So I'm trying to change the paradigm and the way women think about themselves and their breast.
Right. Now, thermography is a diagnostic tool.
Correct.
June. What other kind of things does it diagnose?
Well, we do have quite a few men clients, and but also I do encourage people when they come in for their initial screening to have upper body and the head as well, because it can show dental problems, sinus problems, TMJ, it can show thyroid issues, uterine, colon, even prostate, which I think is curious because we only image from the pubic bone up when we do the upper body in men. I even had a report come back recently that the doctor recommended testing for diabetes, low immune function. So it's an amazing diagnostic tool, but one of the things that excites me the most about it is that it's safe. There's no radiation,
Right.
and we do not touch the client. I don't even really look at the client. I am looking at the computer screen at the whole time. So it's women in particular in regards to breast health is not having a diagnostic tool that radiates them that can increase chances of cancer, as well as the compression, which can cause problems as well.
First time I
Absolutely.
ever saw thermography was with a patient with reflex sympathetic dystrophy, where they had had a nerve damage and one leg was not getting as much circulation. Well, that was kind of
Right.
hard to tell. We were doing Doppler flow and trying to check temperatures. Did thermography on it, and it just lights up. Here's this leg that's nice warm colors, red and yellow, and here's this other leg that's blue. And it was just stark. The contrast
Yeah.
was so obvious.
So do you give a written report of this, or do patients look at the actual?
Well, certainly the
Is it called a
patients look at it,
thermogram?
but we send it off to a certified MD or DO that's licensed to read them, a
Right.
licensed physician in the United States, and the patient gets a report back, and so that's
There
what
are
it's-
recommendations made in the report when the doctor interprets it, what should be the follow-up from that point forward.
Now, you send it to the MD. Do you send it to their primary care physician, or just who
That's up
gets
to the
it?
patient. We encourage
Whoever
them to,
whoever their doctor
because
is.
doctors actually need educating too. We only know what we know, and we have to be educated sometimes too. That's why the drug companies all send reps around regularly, and in this case, patients will educate their physicians
Yeah.
as to.
Do hospitals accept these and keep them on record for you? Or
Many doctors
some of them
are very familiar with them, but since it is interpreted by a medical doctor, it does become a part of the patient's file if they bring it to their doctor. And so if their personal physician chooses to ignore the report, then they can be liable.
It's interesting. You know, I've gone to India several times. It's a primary diagnostic tool over there. It doesn't. There's no radiation. There's no smashing or squeezing. It's very intimate into the medical system there. They aren't about, and they haven't already invested. By 1992, when it was reapproved by the FDA, the medical establishment had invested so heavily in mammography equipment and spent so much time promoting it and enrolling women into it. It was like they couldn't make the switch. The other problem is you can get a thermography without a doctor's prescription, so they didn't have control over that.
Right.
So there's some different political issues there, if you would, but that doesn't make it any less of a test. It's a dream of a test. The patient never gets touched, never gets injured.